And today, Providence researchers are releasing their findings of a COVID-19 antibody study. This looked at the positive rate of antibodies in healthcare workers. Our Fox 12's Sarah Hurwitz spoke with one of the lead researchers for this. She joins us live with how this could give more insight into the fight against the virus. Sarah?
Well, hey, this study, it tested more than 10,000 Providence employees and those affiliated with Providence. The result was a low positivity rate for antibodies, which researchers say suggests that PPE is protecting those who are most at risk. Providence researchers conducted the study back in April during a time when lead researcher Dr. Ram Leidner says there was very little known about antibody levels in healthcare workers. He says there was a real concern that healthcare workers would be at highest risk of being exposed to COVID-19.
Typically, when you're exposed to a virus, your body develops antibodies against that virus that could protect you, help get rid of the virus, and then protect you from getting that virus again. And it was important for me to mention that when we started this, little, if anything, was known about the antibody response to this virus. There are some viruses where the antibody response isn't very strong, right? There are some viruses where you can have antibodies, but it doesn't help you.
In this case, according to the study, 253 healthcare workers tested positive for COVID-19 antibodies. That's a little more than 2.5%.
What that told us was that the strict social distancing measures, the mandatory PPE in the hospital, all of this was working.
According to Providence, this study was conducted during April and May when PPE was starting to become mandated and during the peak period of the pandemic in Oregon. So how do the results of this study give researchers more clarity in the fight against COVID-19?
Testing for antibodies may not be the way to know about this virus, and it remains a completely open question as far as I can tell whether having antibodies makes you immune or not.
And that doctor you heard from there said that these tests were run in a clinical laboratory with a machine that can run more than 1,000 tests per day. He says that all you need is a small amount of blood to actually do the test. And then the rest of the blood that's taken during these tests is actually stored and can be used for future research as we continue our fight against COVID-19. Reporting live here in Portland, Sarah Hurwitz, Fox 12 Oregon.